All right, so this is the last video of Chapter 6, the integumentary system. This is about the healing of cuts and burns. Again, this is slides 36 through 41 on our McGraw-Hill PowerPoints. So we start with this idea of healing, and one of the things that's going to happen in areas of the integumentary system when it gets injured, we will see what's called inflammation. Now, don't confuse this with edema or, inflammation is a normal response to an injury or some sort of stress. Now, one of the things it's doing is going to try to restrict the spread of an infection. The blood vessels in the infected area are going to dilate and become more permeable, which allows the fluids, including white blood cells that are in there, to leak to the damaged tissues. Now, there are four main signs of inflammation, and they should be just common sense. The skin in the inflamed area is going to be reddened. I'm putting more blood in an area. Blood is red, so the skin, the area, will be reddened. The next is it will be swollen. I am putting more fluid in an area that is more fluid than normal, so it's going to swell up. If I blow air into a balloon, it is going to swell. Because blood is warmer than normal tissue, it is what our body uses to pass things along, or pass the heat around, to move heat, so to speak. If I put blood in an area, it's going to be warm. And if I'm already putting extra fluid into an area that is hurt, it is going to be painful. Red, swollen, warm, and painful should all be common sense. Duh, right? It is red because blood's going to be there. It is swollen because more fluid's going to be in there. It is going to be warm because blood is warm. And it's going to be painful because it's already in an area that's a problem. Hopefully that makes sense. As far as cuts go, again, in this, we really do not get deep in this literally. This chapter for us in our book divided into two things: a shallow cut and a deep cut. In a shallow cut, it is only going into the epidermis. It does not get into the dermis. It doesn't cross the basement membrane. This is considered a shallow cut. It is going to repair rapidly. This is almost like a minor scratch. A deep cut is when it reaches the dermis and sometimes the subcutaneous layer, the hypodermis, and that's a little bit more of an issue. Once I get into the dermis, now I'm going to get into the capillary bed, the dermal papilla, and so we're going to have more blood. And so we're going to have the body trying to produce a clot. Now, in 211, you are going to get into how blood in the circulatory system, platelets, and how blood clots are formed. This is going to be a very basic idea of this. So the clot is going to form. It consists of fibrin and blood cells and platelets. And this fibrin, it's like a cast net. Fibrin's going to be this net, then it starts catching blood cells and platelets, and it starts forming this clot, which turns into a scab as the clot dries. Epithelial cells will start working underneath this scab to fill in the wound. You're going to see that there's a growth. It's called anyway. There's a hormone that our body will produce, a chemical our body produces, and it causes these epithelial cells to start growing at a rapid pace. Fibroblasts that are there are going to secrete collagen and fibers to bind it together, but they will also secrete elastic tissue fibers. And if you have fibroblasts that don't secrete a lot of elastic, that's when you get those scars, a keloid. These growth factors, again, the growth factors are what I was talking about up here. They're going to cause these epithelial cells to start really reproducing quickly. Phagocytic cells are going to move in. These are going to be also those dendritic cells that we talked about in the earlier chapter. They're going to come through and kind of remove the dead cells and the debris as the scab sloughs off. If I have excess collagenous fibers, like I said up here, from these fibroblasts, it's going to end up having what we call a scar. This is pictures. There's going to be some pictures that are kind of showing it. It's not a big deal. Again, the big thing for me in my class is making sure you understand superficial cuts do not pass the basement membrane. They are just affecting the epidermis, so they're not going to cause major bleeding or anything, and they heal rapidly. Deep cuts, by our book standards, are anything that passes that basement membrane, which means it gets into the dermis. Now we're talking about disrupting blood vessels, and then you're going to have more bleeding, which is going to form a scab as our body clots this to protect. And then underneath that blood clot, we're going to have, and scab, we're going to have the body start doing repair mechanisms for it. The next thing we look at is burns. Now, burns, most of us know burns on this layer: first degree, second degree, and third degree burns. So first degree, second degree, and third degree burns is a good way to know it, but I want you to know this, the scientific name for it. So it's really pretty easy. So we have three, right? We have 2 partial thickness burns and then a full thickness. You should be able to tell that partial thickness isn't as thick as full thickness. So just by simple deductive reasoning, you should know that full thickness burns are third degree burns. Now, the partial thickness are described as superficial and deep. You should be able to tell which is more superficial and which is more deep with this. So that's the idea. So you should know superficial partial thickness is first degree burns. Deep partial thickness is second degree burns. Full thickness burns are third degree burns. The partial thickness is talking about the cutaneous membrane, whether it's full thickness or partial thickness. So superficial partial thickness, which are first degree burns, are only epidermis burns. They are not going to get through, kind of like those superficial cuts. They're not going to get through to the dermis, and so it's not going to have much of a major problem. It calls it a sunburn here, but when we're talking about a sunburn on this, I'm not talking about I laid out for 4 hours at the beach and didn't protect myself. I'm talking about I'm outside and I got a little bit of redness. It's not going to peel, it's not going to blister, it's going to go away, but I can tell that my skin was out in the sun. A true sunburn, like most people would think, end up getting into close to the second degree burns, but we'll talk about that in a second. So this is going to have no scarring, it's not going to blister, and it takes just a few days to basically to heal. Now this deep partial thickness is going to be something a little different. So now this is going to get into that upper part of the dermis. Now in the upper part of the dermis, we're talking about this capillary layer, this papillary layer of the dermis. So right away, we're going to start having problems with blood flow. This is going to cause us to have blisters. This deep partial thickness, the second degree burn, will have blisters, and it will heal, and there's usually no scarring, but now we're talking about something that can end up causing problems long term as far as scarring or as far as cancer type stuff, because once I got through to the dermis, that means that I affected the stratum basal, which is that area of highly mitotic cells. So again, just kind of keeping up with this. I hope that makes sense. Again, the healing varies, as it says, with the severity of the burn, which should make sense, and stem cells and how the stem cells can move. Again, generally, most everything will repair and get back to normal. But when we get to the third degree burns, and I hope no one in here has had to deal with third degree burns, which many people have, and it is a terrible thing. Third-degree burns get through both the epidermis and the dermis. It is called full thickness because it affects the entire cutaneous membrane. It is full thickness of it. This is going to be a very bad injury. It is going to require skin grafts. It definitely is going to have scarring, and it's a problem. And again, if you have a full thickness or third-degree burn, you're susceptible to any type of bacterial or viral infection because your first line of defense is gone. All right, so I hope that those make sense. Again, just going over it again pretty quickly as I try to erase my little scratches on here. Superficial partial thickness is first-degree burn. Again, the thickness we're talking about is the cutaneous membrane. It is not full thickness, it's partial thickness, but even in partial thickness, it's just the topmost layer, superficial. Deep partial thickness is saying I'm not going all the way through the cutaneous membrane, it's still partial thickness, but it's getting a little deeper. Now I'm into the more superficial layer of the dermis. We call that a second-degree burn, and now since I'm in the upper layer of the epidermis, I'm going to be dealing with that dermal capillary bed. And so at that point, I'm going to have blistering and probably, it's going to take a little longer to heal and potential long-term issues. But in general, there's not going to be scarring, depending on how big it is, of course, how large it is. And then full thickness, again, now I've got a burn that extends all the way down to the hypodermis, the subcutaneous, which means it is across the full thickness of the cutaneous membrane. That's why it is full thickness burn. It is a third-degree burn. It is a very bad burn. It's going to require skin grafts, and it is going to cause scarring, and it is the worst of the burns. When we look at how we measure burns and we look at it, it's called the rule of nines. We give our body different parts or different measurements, rules of nine. So again, this is how we can figure out the treatment plans and stuff. The next slide is going to have the pictures. I'm going to go to it. So remember the rule of nines. So in this we have, and we'll start with our arms. Our arms are considered 9% of our total body mass, the superficial, the cutaneous membrane of it. And so if I have a burn on my arm from my fingertips up to my shoulder, front and back, it is 9% of my body if it's just on one arm. If I have it, and I'm only going to use for us half, so we'll say either from the elbow down, maybe front and back, or if it's just one side, just the posterior side, shoulder to fingers. If that's the case, it's 4.5% because it's half of 9. The legs, our lower extremities, are going to be double the size of our arms. So the each leg is considered 18% of our body. And so if I have a burn on my body, the full length of my leg, front and back, from my toes to my hip, that is an 18% burn. And no matter how I divide it up, it's 9. So if I divide it in half and say, one leg from the knee down to the foot, front and back, that's 9%. If I say, just on the front, I fell asleep, with my one leg hanging out and only on the anterior surface, that's still 9. If it's front and back, full thing, it is 18. The head itself, front and back, the entire head is 9%. And so if I have a burn just on my face, oh God, that just sounds terrible. If I have a burn just on my face, that is 4.5%. The body itself, the trunk, the front is 18% and the back is 18%. So if I burn the front, I'm laying out and, I've got a reverse type shirt, so my arms are covered, my legs are covered, and it's just my chest, and I burn my chest, that is 18%. If I burn my chest and my back, front and back, it is 36%. It's still all rules of 9. The only one that doesn't play well with that is this one right here, and I am not going to mention it because I just don't even want to think about burns in that area. But it is 1%. But that 1% is a lot different than the 9% everywhere else. And I hope you are picking up what I'm throwing down there, but that's where I'm going to leave it. And as we move on, we're only one slide away from the end. And this slide is one that I'm not going to really cover. Lifespan changes. Because I am getting older, when I read this, all I see is how everything breaks down. In our chapters as we go through, we'll have these lifespan changes at the end of it. And in general, I don't know that I've ever seen one that has anything that was good said about it. So I'm not going to cover it. I would read through it if you want to kind of just check things out, because it does give you some ideas of what's going on. But for me, I'm not going to test you on it, but and I'm not going to cover it. So that's that. Anyway, this does it for our videos covering Chapter 6, the integumentary system. I hope that made sense. And I hope everyone has a wonderful day. Take care.